Hiya! So welcome to a live Facebook presentation. So I have a new series. It's called the Wise Women Educational Series, and it happens every month, and it's totally free, and it's for midwives and students to hop on and have some info and conversation about the practice of midwifery. And today we are doing our very first, and this is about the anatomy of a birth bag. So we've devoted a whole hour to this. So if you're just joining, make sure and say hi, and let us know where you are tuning in from. I'm really excited to be able to host this today. And like I said, this is a first in a series. So we're going to be doing, my company is Wise Women Consulting, and every month I'm going to do a free Facebook Live webinar about a different topic. And this one is about the anatomy of a birth bag. So hey folks, if you're just joining, go ahead and say hey. Hi Melissa, so good to see you. Say hey, and let me know where you're tuning in from. I'd love to have a bunch of comments that just say your location in this country or in the world. We have some folks that are going to try to join that are international. So I got a tremendous response from this topic and for this idea. And so I'm really excited to be offering this as a series. Every month we're going to have a new topic. So at the end of today, I'm going to be asking for folks to give me some ideas for topics that they want to see. Hey Suzanne, good to see you. So yeah, go ahead and say hi to me, and also say where you are tuning in from. Where in the world are you calling from or viewing from? Because I think this is going to be a pretty diverse group, and it's going to be fun to see that. So, like I said, this is going to be the first in a series of live Facebook Live posts on different midwifery topics. And this first one is on the anatomy of a birth bag. And so we're going to jump in and talk about what we bring to birth and why. I'm going to take some time to walk you through my bag so that we can kind of get up close and personal about what it is that I'm bringing to birth, and also be able to answer your questions. We got Melissa from Ventura, California. Thanks. And we have one from Tecate, Mexico. Hola, chica. Yeah, definitely. If you're just joining, go ahead and post where you're calling from, because I think it'll be fun to have this community of midwifery that's going to evolve out of this work. Yeah, aloha. Oh, I got Lilane from Hawaii. Hi, girl. How you doing? It's so good to see ya. Miss you. It's really cold where I am. I miss Hawaii. Yeah, so if you're just joining, go ahead and tell us where you're saying hi from. That's always fun. And also, I'm going to do a little bit of introduction about where I'm from and what I'm doing. So if you don't know me, I am a midwife, and oh, hey, Amy. Good to see you, Monterey, California. That's awesome. I'm a midwife. I have been catching babies for 18 years this spring. Can't believe it. It goes fast to hold on to the fun times. And I have been in Oregon for the last 11 years, and I started on the East Coast. I'm based out of San Diego, California now. I do not practice. I'm exclusively in education now, which is really good for my adrenals and really fun for me because I love teaching. So I run a national consulting firm called Wise Women Care, or Wise Women Consulting. And Wise Women Consulting does help with startup for women midwives who are just graduating and getting ready to start up their practices. So what I do is help folks figure out all their policies and procedures and their informed consents and all their back office paperwork, contracts. I can help streamline that for you. You can actually do actual creation or just editing. I also have a graphic designer on my team who can do some incredible branding work. And I've also in the process of partnering with a lawyer, so we can also do legal advising support as well. So Wise Women Consulting also helps birth centers start up. So if you have a hankering to open a birth center in your area, please let us know, and I'd be happy to help you with that. So if you're just joining in, let us know where you're calling from, where you're tuning in from. Oh, I see Michelle from California. Hey, baby. Yeah, so happy to see you guys. So definitely let me know where you're from. I love to see that. So Wise Women Consulting does work all around the country, and I'm working with a birth center startup in Sacramento right now, and another one in Santa Cruz right now. We have a birth center initiative on Big Island that I'm helping, and a couple more. And so, like, if that's something you want to do, let me know. I would love to set that up for folks around the country. Hey, Danny, see you from Medford. Good to see you. Another thing that I do is I also teach advanced practice midwifery workshops, and these are for practicing midwives and senior students to do hands-on skills development in a number of topics. And so if that's something you're interested in, please consider signing up for a workshop. It's really fun. Some of our ladies on this call have been in my workshops. Go ahead and give us a holler if you enjoyed those workshops. It's really a lot of fun. So those workshops happen around the country. I've just done a lot in 2016. I got one left, and that will be in Arkansas. So if those folks in the middle of the country, I'm going to be in Arkansas at the end of December. And then I'll have another advanced practice workshop in Knoxville, Tennessee in March. And then I'll be on Oahu in May. And that's my current schedule. If you want to hire me to come to your neck of the woods and teach IVs or pharmacology or suturing, any of that stuff, let me know. I'd love to come to your area. And go ahead and either send me an email or leave me a post here about what you'd like, where you'd like me to come, and your email, and I'll follow up with you. Okay, so if you're just joining, hey, welcome. Good to see so many folks on the call. So if you're just joining us, just do a quick type where you're calling from. I see Orange, California. Hey, Jessica and Nikki. Hi, girls. How you doing? So happy to see you. So let me jump into my third little hat that I wear. I am also the clinical education leader at Najoni Institute of Midwifery in San Diego. And so this is a really awesome MEAC accredited midwifery school. You get me as one of your teachers if you come, so definitely consider that option if you're a new student. It is not distant school yet. We are on location only, but that means you get to hang out in the classroom with some really cool ladies who are becoming midwives and some amazing San Diego midwives who are teaching, and I do all of the clinical education piece. So I'm happy to be there at Najoni. Awesome. Okay, well, welcome. Oh, look, Anchorage. Hi, Anchorage, Alaska. Miss Bethel, how you doing? Good to see you. Oh, this is so fun. Well, our call is getting nice and big. We got a lot of people tuning in. That's really fun. Thousand Oaks, California. Hey, good to see ya. How you doing, Carrie? Look. There's so many fun people here. I can't even keep up with it. That's so great. Oh, wow. Sabrina, are you from Mississippi? I can never remember. Is that Mississippi or Missouri? Ooh, I'm bad with that. Anyway. Aloha. We got Oahu mamas. How you doing, Kaliko? Good to see you. Oh, this is so fun. I love it. Well, listen, today we're going to jump in on the topic of the anatomy of a birth bag. And so what does that mean? Mostly I'm just trying to talk to you guys about, hey, Santa Cruz, good to see you. I'm just want to talk to you guys about what we bring to birth and why. And so I am really open to questions today, and we're going to do a visual walkthrough of some items that I have pulled out that I think are appropriate. But first I want to kind of talk about in a big picture kind of way. So everyone is probably very aware, if you're practicing midwifery, you're very aware that midwifery is under a lot of pressure right now. There is a lot of pushback from the mainstream medical world, and it is in some ways very warranted and very appropriate because we do all want to have the goal of safety first. But in other ways, it's very punitive and inappropriate because, of course, in the United States, we're practicing in a for-profit medical system. And actually, the more popular midwives get, the more business we take from the mainstream medical practice and providers. So there's some appropriate and helpful record keeping and conservative kind of questioning. Is this safe? But then again, there's also some really aggressive and actually incredibly inappropriate, hostile discrimination and persecution. And so it's really important that we as midwives, especially you new midwives coming into practice, it's really important that you know this and you acknowledge this. First of all, so that you don't get yourself in over your head and you realize that the profession that you've chosen and that you're going into is really a challenge. It's not a walk in the park. It's definitely about, pushing against the mainstream. So that can be really challenging and daunting and exhausting. And so it's important that you know what you're getting yourself into. But more than that, it's important that we understand so that we can tailor our image, our practice, our words in such a way that we are continuing to further the professionalism, the integrity of the profession. And so what we bring to birth is one of those most crucial places. And then, of course, I'll take it one step beyond that. How we bring it to birth, I think, is quite important because, unfortunately, we, for whatever reason, we do live in a very image-based culture. People really do put a lot of weight on what they see, and they judge what they see, unfortunately. And so we have to be cognizant of how we are being perceived. So I've said this before, I said it all the time, perception's 9/10 of understanding, i.e. we can only understand that which we perceive. So in talking about what to bring to birth, cultural competency is a huge part of this as well. You have to know who you're serving, what they believe, what they perceive, and then be able to see yourself critically to know how you're perceived, how you're judged. And it can be negative to think about it this way, but I think it's a really important part of the process. I mean, I don't think it's negative personally. I think it's actually really constructive and helps us all grow. And I think we should be able to serve the majority of Americans, because the majority of Americans really can and should be normal. And of course, midwives are the caregivers of normal. But it is definitely important to think about. So for instance, there are many different types of folks here in the US. And if you're serving a very cloaked Muslim community or even a Hasidic Jew community that has a specific morals and beliefs and attitudes around clothing and dressing, what you wear to birth, what you bring to birth will really be different than if you're serving a Rastafarian group of families or a really suburbanite kind of well-educated, incredibly, intellectual college set, right? It's really different to pay attention to who we might serve in the community. And so if you're apprenticing, you're getting to go out into your community. If you're new practicing or have been practicing for a while, you're getting to go out into your community and really you should have an understanding of who it is that you serve. And so knowing how you will be perceived, what you wear, and what you bring into their home will be very, very important. So I tend to always err on the side of professionalism and really conservatism myself. I think that is the most common denominator in terms of being accepted and appreciated as a provider. And so for me, it's about finding that blend between really out there midwifery where we're just like free spirits and one with the everything and, flowing skirts and Birkenstocks or whatever, which I mean, no criticism at all. It's totally awesome. I have Birks. And the very uptight, kind of scrub wearing, kind of image as well. And, I also have scrubs and I'm all about that too. But it's about finding the balance, right? So it's about finding the balance between those two extremes to know what to show to your clients. So there are a number of different bags, different collections of bags that folks use. There's some popular ones out there. I think duck has been a serious focus over the years. Hey, I'm just going to take a moment and say, hey, if you're just joining us, welcome. So happy to see you. This is a live Facebook post about the anatomy of a birth bag. If you're just joining, go ahead and quickly type where you are tuning in from, and also feel free to click that follow button at the base of your screen there. That way you'll get alerted when I do another one of these. And I'm going to do them every month, and they're totally free, and so it'll give you an opportunity to check in with us. So if you're just joining us, type your name and maybe, or your name's right here, but where you're calling from, so that we can all see where folks are tuning in from. Oh, look at this. Wisconsin, hey! And Medford, hey. How you doing, Tanisha? Good to see you. There's a duck brand out there that a lot of EMTs use for their bags. Chicago, Illinois, hey, good to see ya. Santa Cruz, hey girl, how you doing? So exciting, I love it. Yes, this is being recorded. You can watch it later for sure. It'll be under my video section on my Facebook page. And Santa Cruz at the moment. Hey, how you doing? That's cool. Gosh, there's so many. Missouri, Oregon, Los Angeles. Oh my God, I dig it. Hey guys, how you doing? So fun to see folks, I know. What type of bag that you actually carry, or what conglomeration of bags that you carry, again, you want that to fit that image that you're aware that you're projecting. And there's no judgment here. There are midwives on this circle and in this country who serve a very accepting, loving, very free-flowing, hippie, much more lack of need, or even eschewing the idea of it being a medical procedure, right? Home birth could be incredibly normal and natural for some families, some communities, where they expect you to show up in Birkenstocks and flowing skirts with long hair and, you know, your bunch of bags, and that's what they think is normal. And then there are midwives on this list and in this culture who serve communities that expect them to show up in scrubs with everything tight and really put together. And so there's really nothing wrong with either. It's just about knowing the group that you serve and the various ranges within there. And of course, the more you can become aware of this, the more culturally competent you are. British, I love it. Vancouver Island, hey, just 7 way. I love it. And Beaverton, Oregon, I'm just loving this. Okay. Anyway, I get distracted. My ADD is going to take over. Just knowing who you serve and wanting to be really clear about what it is that you project, so that you know how people are taking you in. So let's take a moment and let's just look at a couple different groups of bags. So here's some folks are bringing, right? We have the basket routine. And so that could be really useful if you are climbing a bunch of stairs. So folks in New York who are doing a lot of apartment births are probably taking smaller bags so that they can take a few trips or hand them off to other people instead of the giant bags. So again, just knowing who you're serving. So here's another method that some people utilize, more like the suitcase method. Some of them are wheeled, some not. That can work really well too, but they can be really, really heavy, and you have to realize how you're perceived. If you walk into a room looking like Santa Claus carrying giant bags, what does that say about you, right? So this is, again, all part of your investigation. Wives are bringing, more like cases that are open. That could work too, although it's a little bit less professional in my opinion. And these are mobile kits, and that's because I do birth in Oregon, where it could be sunny and 2 hours later hailing. And so we go through a lot of interesting all-weather gear. And so I have two cases here. The other reason I like the hard case that's wheeled, they're both wheeled. The other reason I like the hard cases is because everything is completely waterproof and protected. So if it's pouring rain, I can still hike a mile up to someone's house. And also, when it's hard case, it means that functions as another seat. So in lots of small houses, we don't actually have enough seating for the midwives. You know how that goes. And so I use that. It can also be a table for baby board and all kinds of things like that. So just that, going back to the focus around who you are and what you're putting out there, so that you can have better choices around what you're bringing. So let's do a real quick poll here. Those of you who are attending births, go ahead and type in whether you like to carry a soft bag or a hard bag, and whether you like to have one or two or many. Let's just get some experience here. What's your preference for folks? Okay. Soft, 2 bags is one comment there. Let's see. 2 bags soft. Okay, so we're getting that. Oh, good. We have soft bag, prefer 2 compared to 1 against a big heavy bag. Yep, I agree. Okay, so we've got some things broken out, like a small suture bag, because you don't usually need that emergently. I'm going to do the unthinkable and put my reading glasses on. I'm old now, so I need to read that. Several soft bags, okay. Hard-sided canvas tool bag, Home Depot, and a duffel bag. That's cool. Yep, wheeled craft carts. That's cool. Hard bags. Cool. So you guys got a lot of different opinions there. Again, there's no wrong choice. There's a lot of different options. Mine come from Home Depot. They're tool boxes for traveling construction workers, and they're really tough. And those bags, those containers are actually 12 years old, so they're still pretty sturdy, and they've been used a lot. Okay, look, we've got a few people joining in. Hey, from Mississippi, good to see you. If you're just joining us, go ahead and say where you're calling from. So exciting. Yeah, so we had someone say that they have a precipitous bag, and I love that idea too. If especially if you serve a multip, a pretty large multip group, you might need to use you might need to have something really quick to just grab and go, because you're coming into a lot of precipitous births. So all of your emergency birth equipment is in one bag. And I love that idea. If that's your reality, or you have long distances that you travel to births, that might be a really great option. So you have a grab and go. Hey, from Alabama, good to see ya. Hey, love that. So we have some soft diaper bag options, hard suitcase. Orange County, hey, Najoni student, how you doing? I love that, Hannah, that's great. Yeah, so if you're just joining us, go ahead and say hey and where you're joining us from. We're talking about the different types of bags that people have used. So one might be the hard-sided suitcases, because of course everything's really protected. Some folks have talked about soft-sided bags. I saw a diaper bag or a camera bag. All of these are good options. I bought mine from Home Depot. Mine are super sturdy. But like I said, I practice in an area where it can rain and snow and sleet and hail and be sunny all in the same day. So that's how Oregon is. And we sometimes have folks that live off grid, and so we have to park and then hike in. And so my bags have wheels so that I can do that. But if you are an apartment midwife, you do a lot of births in the city and walk upstairs, then maybe you want a bunch of small bags so that you can hand them off to people or come in that way. So if you're just joining us, go ahead and say, hey, where you're from. And also you can click that follow button so you can get alerted when I do one of these again. And they're going to be a monthly series now. So I look forward to seeing y'all there. Okay, so a little chat about bags. Let's go right into the stuff, what the stuff is inside the bags. And I know we have folks joining us from all over the country. And so I'm going to kind of go from least invasive to more invasive so that you all can sort of find the level that works for your community. So obviously, I'm going to switch the orientation here. So obviously, we all want to have a way to monitor baby. Fetoscopes work fine for pregnancy, but they don't work well in labor because it's really hard to make a mama lay still and be quiet to listen for as long as you actually need to. Now, if you'd like a more in-depth conversation about fetal monitoring, I do teach advanced practice midwifery around fetal monitoring, and it's a very in-depth class. So if that's something you'd like to do, I have a couple workshops coming up, and I'm going to announce those in a minute. So I used to use the gel with the Dopplers, and I've switched to lotion because then I can just rub it in instead of hunting for paper towel or cloth, and it conducts just the same. And I choose a nice, really good, healthy lotion that smells little uplifting. I have the lime scent, I think citrus, whatever. And that seems to work just fine for me. Don't forget to have extra batteries. That's a really important thing whenever you're using Dopplers because obviously there's all kinds of reasons why those batteries can go quickly. So make sure you pack extra batteries. We also would like to have a scale and sling. I know we have those old-timey fish scales that have little graduated marks and the weight and the spring, and you kind of read it, and it's like by the 2 or 4 ounce sections. And I really recommend that you switch to the digital, especially when we're talking about failure to thrive and needing specific weights. The digital fish scales work exactly the same, and they're much more accurate, but you do need to pack batteries for those as well. Obviously, measuring tape, stethoscope, blood pressure cuff. Make sure you have your large size. That's really important because having the wrong size can give you really, really wrong measurements. Okay. So, any questions so far? That's pretty straightforward. We're going to move on into another section here, and I'm just going to kind of walk through things. If you have questions, I'm going to try to pay attention to them and answer them as we go. Oh yeah, Lisa, aloe gel. Yep, works the same way. Aloe gel is just the same, and that's a great option. Okay, so having your glove and your lubricated jelly to do a vaginal exam is definitely something you'll want to have there. To be able to do a catheter, and you could have a Foley cath or you could just have a straight cath. This is just an example. You'll need 3 of the Provident iodine swabs, and obviously your gloves, and then you'll need a bedpan to catch that catheter urine, so that's important too. A lot of midwives have these in their kits or have the moms buy them because this is for deep cleaning, and I do recommend it. I don't use it at every birth, but there's quite a lot of times where you get called to a birth after you've spent the day in a garden or at the horse farm or just chasing kids or cooking, and you want to have a way to really get your fingernails clean out of birth. And there's nothing emergently happening usually when you get there. There's plenty of time to do that. And then the major added benefit is that then those used scrubbies can be really great at cleaning your instruments before you dry them, put you in your bag to go home to sterilize. So that's a good way to get off any cake blood that sometimes happens. Oh, hey, Amber, good to see you. One of my last students. Happy to see you. So some midwives also pack some, little emergencies or whatever. There's a lot of different kinds. Certainly that can be helpful to think about mom's nutrition. Chuck's pads are a part of every kit, whether you have mom buy them or not. A mirror and flashlight is kind of invaluable because we have moms in all kinds of interesting positions. So being able to visualize what's happening can be important. Oil. A lot of people use olive oil. We use an arnica infused rosemary scented olive oil. And just kind of brew a big batch and then bottle it. Gauze pads for dealing with bleeding or assessing bleeding. Obviously, always bring a box of non-steriles. You need a lot of them. Then we need to have a way to check to see if the water broke. So these are the old-timey let's see, old-timey pH papers. And then this is the new product called the Amnicator. And all you have to do, like the little pictures show, is just touch the pooling liquid. So that could be at chondroitis or with a sterile speculum exam up at the cervix, and it turns blue if it's amniotic fluid. So I like these because I can send mom home with them, and then I can get sometimes a little more straightforward of an answer if she thinks she's got a slow leak or something like that. And obviously they're a lot more efficient than this if we're doing a speculum exam. Okay, let's see. Yes, okay, thanks Sherry, good reminder. Iodine allergies are real, so make sure and ask for those. And this is a, I don't know if this is an iodine or a, you have to read your packages, make sure that you know. Okay, yeah, these turn blue or black depending on what they're exposed to. Okay, so Nikki, hey, the base is olive oil, and it has arnica leaf and flower and rosemary leaf infused in it. Yeah, so it just sits for 6 weeks and then is strained. It is amazing, thanks. Okay, this is just our bottom oil. Instead of using the big giant bottles of olive oil that never get finished, we just make a little travel one. Okay, we're also going to need to find, sometimes have a way to release her water. We have the Amni hooks here, and if you're not familiar, they have a little barb on the end. And then we have our Amni cot. You know, you really do need to have both. Different situations call for different tools. And I definitely appreciate both for different reasons. And like I said, if you want to go more in depth into that kind of conversation, my workshops are a great place to go. Okay, so we bring swabs because sometimes we want to be able to do a swab after birth. Several times I have delivered placentas that are quite stinky, and so what I want to do is culture mom side and culture baby side and send it to the lab stat. It won't grow out in time for us to do anything different than what we were already planning to do, but it is a really great CYA trick so that if later she has an intrauterine infection, it's demonstrated that it was happening before she delivered, i.e. you didn't give it to her. So if you ever deliver a really questionable placenta, it smells or it has calcifications or it has some kind of really weird growth on it, and I'm seeing more and more of those. I don't know about you guys, in the last 15 years, placentas are getting weirder. Definitely, I'd like to have a culture. Okay, so you'll need to have a way to clamp the cord. The old standard cord clamper guide is here. And then you can have the cord banders. And so I'm a fan of these. We keep them in a little bottle like that so that they don't get lost. And then they thread over this hemostat tool. And then once it's on and we clamp it on baby, then this tool flips that rubber band up and over the cord. So if you haven't done that before, that's really nifty. These guys aren't cheap. I think they're about 90 bucks or something. But they should last you your whole career. And alternatively, there was a company that was making banders with tabs so that an extra rubber tab could be pulled across the cord. And you didn't need this tool, but I've heard that they've been back ordered and or discontinued, so this is the old-timey way to do that. Our smelling salts is another ingredient in birth. I will say, however, that people get some serious addictions to these. I mean, I'm kidding, of course, you don't get addicted to these, but midwives get so kind of freaked out and paranoid about passing out that they have these taped to their shirts and taped to every door frame, and they have them on every tray, and these don't do anything. They won't solve anything. They just smell like, you know, crazy grossness. So if a mom is already passed out, this can bring her eyes open. But it won't stop her from falling. So don't reach for this. Reach for the mom. That's my spare there. Okay, hey, so if you're just joining us, go ahead and say where you're from, where you're tuning in from, because that's always fun for us. Okay, so you're going to need to have a Doppler for the birth process as well. I do like to have a backup Doppler. You just never know. I had a student who dropped 2 Dopplers in a tub at a birth once. That was a really fun birth. $900, $1,500 birth for me. So always bring a second one. Hi from Ventura, good to see ya. Davenport, Iowa, awesome. And Oahu, hey, how you doing? Good to see ya. Okay, so you're gonna need to have instruments as well. Here are the type of instruments I prefer. So let's just have a really quick chat around instruments. It's really important that you purchase several different, one specific type, not several. There are a lot of different types. There's several different types, but this is what I prefer. So in order to understand why, you have to ask yourself, why do we carry instruments in the first place? Hey from Eugene, good to see ya. So why do we carry instruments? We carry instruments because of really only one major emergency. The rest of the time, your instruments could be in the car. You know how it is, right? The baby comes out, the mom holds the baby. 20 minutes later, a placenta comes out. An hour later, everyone's like, oh yeah, maybe we should cut that cord. Or not. Maybe you do a lotus birth and it never happens. So the only reason that we have sterile instruments on a tray, right, reaching available for us is because of one emergency. Anyone want to say what it is? It is because we might have a cord so tight around the neck that we would need to cut it and unwrap it in order to get the baby out. And so because that's the only reason that we have sterile instruments close and available in midwifery care, then we need to make sure we have the right kind of instruments. So if that's the job that we have, it's really important that our instruments be curved. You see that? Because we're trying to get in next to a baby's head where it's tight around a neck. So these curved hemostats are the only real way that we can make that happen. So make sure you don't buy straight hemostats. We need curved ones. And then the only reason that we really have scissors sterile and close to us, other than cutting that tight cord, would be episiotomy. And so make sure that you buy blunt, sharp. We need the blunt side going in for mom and the sharp side on the outside. So blunt, sharp scissors and long curved hemostats to deal with the emergencies that could happen at birth, which is, again, the only reason why we bring those. And of course, they will be clean and sterile and bagged and all those things. We'll need a thermometer to take mom's temperature, sometimes baby's, sometimes the tub. I'm a real fan of the swipey ones on the forehead, but this is what I have right now. It is important that you carry some kind of suction device. I'm very heavily against bulb suctions. I think that they do way more damage than help. And so I'm a fan of the DeLee. I think that this is the most appropriate out-of-hospital tool. In the hospital or in a birth center, there might be wall-mounted suction units, but I think that this is the best option for us out of the hospital. The bulb syringe just tends to damage the baby's nares and are quite aggressive and invasive, whereas the DeLee is quite thin and you can direct and control its pressure and its location. So this is a lot more comfortable for baby and a lot more appropriate. Now, it's also important that we as midwives, if you do not have training in intubation, you do not ever, cannot ever, with any of the tools we have, actually suction a baby's lungs. The only thing that we suction as midwives is the baby's nose, mouth, and perhaps the very top of their throat. So, you know, don't be under the misinterpretation that we need a longer tube to suction out their lungs. We don't suction their lungs. So, this is a really nice guy to get in and get any really thick, heavy gunk out. And that's about all that we need to do with that. And does suction need to happen every time? No, definitely not. It is only happens right before we give a rescue breath. Other than that, I think babies clear their mucus all on their own and don't need routine suturing, or routine suction, sorry. So you might carry a collection of herbs or homeopathy. That's a huge topic. We're not going to go into it in this workshop, but there it is. There's some options there. We do have some Comfort Lancino for mom, a Comfort Peri bottle for mom. You might ask her to buy those, or you might provide them. You might carry a bulb Foley catheter for cervical ripening, and the tools that needed for that. And if that's not something you've added to your practice, feel free to take one of my workshops, because I do teach midwives that. You might also bring regulators and oxygen. If you're not legal to carry oxygen in your state, that's a whole nother conversation. but make sure, I'm just going to go through really quickly, make sure that when you carry regulators, there are two different types of regulators. One only goes to an 8, and one will go to 15 or 25. This is a baby regulator. This is a mom regulator. It's okay if you have both, but if you only have one, make sure you have a mom regulator. You'll also need a key in order, once you place it on the tank, to be able to crack the tank. And then the other thing I really want to say is make sure you check your O-rings every single time you get your birth bag out. So this is the O-ring on the inside here, and this one is fused to the regulator. So that one definitely needs to be replaced. You get a little knife in there. This one, you can see, will come off easily, and then you'll want to take it off every time, and you want to examine it. And so this one looks nice and solid, and it feels squishy to me, and there's no cracks. So that's a good O-ring. So just take it off and examine it every single time you do a birth, because you want to make sure that it isn't cracked or fused to the tank, because that's how you're going to have leaking O2. And not only is that a waste of money because you paid to have your tanks filled, but it also becomes then an extra flammable hazard. Remember, when you carry O2 tanks around, you're carrying around bombs. These become missiles. If they have a crack in the seal here because of blunt force, if it's hit really hard and it gets a crack here, it will be a missile flying the other direction. And obviously it is also flammable. So it's really important that you take good care of your regulator so that you're not putting yourself in danger. Hey from Mississippi, good to see ya. If you're just joining us, go ahead and say where you're joining us from. And we're talking about the anatomy of a birth bag. Okay, so other things you might bring here are your ambu bags. And I know that some people are superstitious about it, but I do recommend you have one for mom. It would be terrible to need this and not have it. And it's just a little piece of plastic to carry around. You definitely need to have one for baby. The way I set up my ambu bag situation is I have a baby resuscitation board. And so this board is solid, hard. It's just like a little bit of plastic board, and whatever fairly lightweight, large, flat surface you can find. A very small or a very thin cutting board might be a good option. And so then it has a heating pad on top of it. And then it has a rolled up towel for the neck roll here in the middle. And then my baby blankets go all over it, and my ambu bag and my baby stuff. And so that way, this setup here is also mobile. So if we're resuscitating a baby that needs transport, we can move it. And it also can be lifted up onto the bed right next to mom. I've used it on mom's lap before when she's on a squatting stool. And it's incredibly portable. So make sure that whenever you get out your ambu bags, you're going to check the face masks as well. They need to be really solid with good cushion, good pillow, so it can't be popped. So make sure that this is true every time by feeling to make sure it's still got good cushion. Now there are different size face masks. Make sure that you carry several different sizes. If you come to a birth and you have unexpected twins that are 4.5 pounds instead of that 7.5 pound singleton you were expecting, or if you have a giant 10-pound baby come out, the little tiny mask won't fit them. So it's important you have several sizes. And then of course, make sure, depending on what brand you have, make sure the prop-off valve is off so that when you push it, if you push more than 40 pounds of pressure, it can escape. That's really important so we don't overinflate baby's lungs. Okay. So let's just take a pause right there. Any questions so far? Any concerns? Anything you want me to go over from what I've talked about so far? And also any comments. Did you see something that you didn't understand, or have any questions for me? And of course, if you're just joining us, tell us where you're calling from. Great. Anyone have any questions? We're moving on. Good. Well, we're getting some people joining. Let's see. Let's see if we can't keep going. So, herbs to take. Yeah, that should be another workshop. That's maybe, hey, from Tennessee, good to see you. That should be another topic. So maybe we'll do an herbs workshop in January or February, something like that. Hey, from Oregon. I'm not going to create a document. Nope. Sorry, Amy. This video will be up for everyone to watch. So, you know, if you want to rewatch this a couple times, feel free. But no, I'm not going to type anything up for this. However, I am really happy to converse with you or be hired as a consultant if you have more questions. Let's see. Yeah, herbs. It sounds like herbs are a real question. Yeah, this is just a tiny selection of the herbaceary, and not sure that it's going to be really helpful. The homeopathic kit is from Washington Homeopathics, and I really love this particular kit. It is 50 of the most common doses in pregnancy and in postpartum. So there's that there. So I could do a whole homeopathy and herb workshop one of these months. If that seems like a topic people would like, go ahead and hit your like button. And I will add that as a topic that we do. Alrighty, so let's move into some more of the specifics that we have here of things that we might bring. Okay, so here is some gloves and lube. Some folks bring this big tube, and some folks bring individual or lube packets. I don't think it really matters. Again, it's about perception, right? Some folks would be quite distressed to feel like they were one of many getting, you know, goop out of a tube. And other women might be quite distressed that you're polluting the environment with so many little packets. I mean, I don't know. It's all about perspective. So I don't really have an opinion. Okay, so how we lay all this out for birth is we use our trays. And so you can just get cheap little inexpensive cookie trays. You could get some really fancy wooden trays, whatever you want to do with that. But then to make them now a very clean location, I would go ahead and cover them with the chucks, and then I would place my items for the births. So what I do is I make a birth tray. So I have my sterile instruments and a smelling salt, and the way that I'm going to clamp the cord, and my gloves and lube, and my oil, and a couple 4x4s. And then this is my birth kit that is now on a very clean surface. And then I cover it with my chucks, and then this is mobile to go sit in any room where we're waiting for a baby. So I usually make a birth kit, a postpartum kit, and then an IV tray, or birth tray, IV tray, and then postpartum tray. So that's just one idea. Folks might have them in little caddies. I know some midwives who use shower caddies. And some midwives who use like a hammock kind of thing. It's like it's cloth, but anyway, whatever you determine is fine. when you pack, does this change from birth to birth depending on what you expect? Yeah, good question, Sarah. No, my birth tray is always the same, and it's basically made up for emergency, quick, needed birth. You know, it's got the basic things that I need as the baby's actually coming out. And my postpartum tray is the same too. And so I guess for the person that asked if I would type it up, I do have what goes on each tray typed that I could send out. And I also think I saw Marilyn say you have a, Meryl said you have a doc. So if you want to share that, great. I'm totally all about the disseminating of information. The more the merrier. But so yeah, I do have a document that says what goes on each tray at my home births, and I would be happy to share that. So good. Okay, so let's see. Going on here, we also have ingredients for a suture kit. So you might have this all in its own bag, or you might have it in a bag within a bag. But the things you're going to need for suture are your suture instruments, hopefully sterilized, and the basic suturing. All you need are needle holders or needle drivers, tissue forceps and scissors, and then gauze. And the way I pack mine is with non-sterile gauze underneath. Then when it goes into the autoclave, this all becomes sterile. Same thing here. You can sterilize just some non-sterile gauze, and then that's a little cheaper than buying these packs. Of course, if you don't have an autoclave, these are a great option. And we're talking about approximately 2 cents of savings. So however you do that is fine. You're obviously going to need sterile gloves. You're going to need your actual suture supplies here. So 3/0 is the most common, 36-inch length string and a cutting taper needle. 4/0 is what I would use for labial tears or for sometimes some perennial skin repairs. And you'll need a bright light. I'm a fan of bright flashlights with an assistant holding it, but if you don't have that, it's good to have a headlamp, because otherwise you're going to have a very traumatized grandmother or father being forced to hold a light for you. Always bring extra batteries, because this is obviously a risk. You're going to need to have lidocaine, and then you're going to need to have a syringe and needles to administer that. So make sure and have an alcohol so that you can alcohol lidocaine that's already open, and then have a syringe. I prefer the control syringes personally, because one of the main risks of using lidocaine in suturing is the risk of anaphylactic shock. And so obviously we're going to do our good health history taking at the beginning of care and make sure that she doesn't have any actual drug allergies to any of the cane drugs like Novocaine or lidocaine. But even so, some women have never had, dental surgery, or have never been exposed to it, or some women don't know that they have an allergy. And of course, an allergy becomes an anaphylactic reaction when it's in the, or lidocaine can cause an anaphylactic reaction when it's in the bloodstream. So one of the main things we want to avoid is injecting lidocaine into her bloodstream. And so the control syringe makes it so much easier to pull back, to check, to make sure that you aren't in a vessel every time you administer in the mucosa of the vagina. And then the other thing that makes it much easier are these little guys. I love these filament syringes, or needles. So this is a, let's see if you can see that. It's a 27 gauge, 1.5 inch filament needle. And what that means is that it's flexible. So if you hold on one second, I'm going to try to show you that. So what you can see here is that it bends. And what that means when this needle can bend is it means that it will go around vessels. So it's a much thinner needle that is obviously more comfortable, but it also, it will do its best to snake around vessels because they're a firmer tissue. So this is a great needle for suturing. Obviously it doesn't have much other application. And it's definitely not that much more expensive. So yeah, look for the filament needle, 27 gauge. It's the yellow ones that I love. And then we would use these more thicker, straightforward. These come free from the lab, you know, in order to put it in the lidocaine. And then anyway, we're getting into how, and we'll do how in my workshops. But yeah, those are the things I like better. We have a draw up needle, and then we have an administer needle, all based off of this control syringe here. Okay, so that's kind of the suturing. I really do love having these angled bed pans. One of the things that makes suturing so difficult at home is that the bed is so squishy, and so if we put this under her bum, then it makes her bum flat to be able to be seen where it's suturing. And then I don't have it here, but I also always carry a stool, a folding stool, so that I can sit at the end of her bed more comfortably than usually anything of the items she has in her house. And then lastly, taking a disposable speculum with you is great because these can come apart. And then these can be, these can both be used as a, like a vaginal retractor, especially if you have a very deep tear. Vaginal retractors are quite expensive, like $10, $12 a piece. And they're also plastic and disposable, whereas this is $1.75 or something like that. And so these two hinged parts right here, they just easily break apart. And then you turn the bills in opposite directions, and your assistant can actually hold the vagina open fairly comfortably for you to be able to suture deep in the posterior fornix. So this is a great tool as well. Okay, you might be able to take some meds with you. And so I do recommend always bringing basic blood draw equipment. You never know when you want to get a CBC from a mom, or actually get something from the baby. So always have a blood draws for both, and make sure and have your lab rec and your stat bag, because of course this is always going to run stat. And for baby, make sure for the baby microtubes, make sure that we have our light occluding one in case we're going to get a jaundice level, because in the time it takes you to draw it and take it to the lab, it will be completely invalidated, because the light will affect what's in the little microtainer pretty significantly. So if you don't know how to do this, or you haven't done this before, make sure and take my workshop. I do advanced practice midwifery workshops around the country, and the next one is in Arkansas. Okay, so if you're going to carry Methergin, obviously you're going to need to have a syringe and alcohol. Methergin is the blue top, Pitocin is the green top. And remember, the thing about Methergin is this is never, ever, ever an IV medication, only IM. Pitocin can be used either. I do recommend you don't buy Methergin in a ampule. Of course, we all know about that midwife who gave the baby a Methergin instead of a vitamin K. So that's definitely a concern, and we mitigate that by just buying them in the single dose vials. If you carry Cytotec, I do recommend you get it bubble packed. And this comes in a big pack of all the bubbles, and then we cut them into the dosage and relabel them on the back. And so then we have our portable 800 milligram standard dose for postpartum hemorrhage, like that. And they're safe and they don't crush, and it's a lot better that way. Okay, and then of course potentially you'll be giving vitamin K as well. Those come in single dose ampules, and they also come in pre-dosed syringes. The pre-dosed syringe is a great option, but it's about twice as expensive, so however you want to do that is fine. There's a lot of debate around the filter needle. If any of you have watched a epidural, you will see that all of the medication that goes into the epidural comes through in glass ampules, and the docs break them open and inject them without using filter needles. So the midwives using the filter needles to draw out of glass ampules has been sort of ridiculed by the medical world. If you want to keep using a filter needle, there's nothing wrong with that. Go right ahead. It's just one little simple double step. It's not going to cause any harm and could potentially be of benefit. But if you don't use it, I don't think you're going to catch any flack, because nobody else does. Okay. Let's see. Danielle, you're asking a question. What do you use to draw cord blood? Yeah, definitely. Cord blood comes up in, it's a red top tube, and you can use a vacutainer just like you would do a regular blood draw. You actually alcohol and betadine a large section on the vessel, like on the placental surface or on the cord. And then with your one hand holding the cord straight, you can just insert your vacutainer and depress your vacuum tube there, and you should be able to get just the normal amount of blood. Half a container, half a vacutainer is all that's needed to process cord blood. So yeah, definitely that would work. Hope that answers your question. Okay, so because we carry lidocaine, we also carry epinephrine because of the risk of anaphylactic response. So I packaged up these little cases in my practice because, first of all, I don't want anyone to ever drop lidocaine or epinephrine unnecessarily. Hold on one second. I'm going to open this. I don't want anyone to ever open epinephrine unnecessarily, number one, and number two, it's a very, very, very rare occurrence, and I want there to be a few steps before it ever gets accidentally administered. So here is what my epinephrine says, and it gives the dosage and also talks about what's in here. So we make a very specific little package. I have never given epinephrine in my entire 18-year career with almost 1,000 births I've attended, but it's important to have it just in case. So here it all comes packaged up here. The other thing that we've added to this emergency case is 2 clear Benadryl. You can kind of see there. And a scalpel to lance them open so that the Benadryl can be given vocally. So this would be given in a situation that was not anaphylactic. So she had swelling, itching, and we were concerned she was becoming allergic. Then this could be a temporary administration on the way to the hospital before or instead of epinephrine if it was not a true-blown respiratory issue. We might also carry eye ointment, and that is our med section there. We might also bring an IV kit, and so you would need to have IV fluid in date. And if you would like more information around IV medication or how to give IVs, definitely feel free to take my workshop. We do a 4-hour workshop, and almost everyone comes out feeling very confident that they can do IVs afterwards. So you will need a Chox pad, a line, and a start kit. You can either make your own start kit, or you can buy a packaged IV start kit. Doesn't matter. This one saves about 10 cents. And then you also need to have your needles. So what size needle you bring and use is dependent upon the mom and your skill. So definitely have a few out. If you have to give a hand IV, it's very different than getting an AC in. You have a mom who's passed out and bleeding on the floor. It's very different than someone who's just tired in labor. So those are all different things. You'll need to have a few syringes to transfer fluid sometimes, or to deal with a line that's not flowing. And then if you are giving medication, you'll want to have just a little saline lock there. Obviously, you're going to need tape and or a Band-Aid with gauze to stop the bleeding. Now, the old-timey method is to hang the IV bag on a hanger, and then we hang it up on the bed or we hang it up on the light fixture. You can also purchase these portable IV stands, like yay, but I find that the hanger works just as well. Alrighty, so we've gone through a significant amount of stuff. Make sure you have your sharps container and then your Sandy wipes to clean all of your non-disposable items. Alrighty, now we're going to go back and just sort of chat about what we've talked about, and I want to answer any questions you have. So if that was helpful to you, go ahead and give a big thumbs up so we can all see the response. And then if you have questions for me, I'd be happy to answer them. And I'm just going to quickly log on here and see if I can read your questions a little bit better. Hey, folks, good to see you. So, my question for you all is, let's see, look at that, 12:59. Oh, I love it. Okay, so now we're into questions. If you guys have questions about what I set up for you or what it would look like, let me know. I'm going to try to answer those questions. And then same thing, if you have questions about where to get things or anything like that, let me know. Okay, let's see. We got some things pulling in. Thanks, Meryl. I miss you. Hope you're doing well. Good to see ya. Let's see. Yeah, I did have sterile water out. Thanks, Meryl. Did I miss to say that? Yeah, I did have the sterile water papules out, but we didn't go into that. That's another great option if you guys don't know how to. I teach those in my workshops as well. Okay, so best place to order. Well, you know, I'm a real fan of the Orion Medical Company. They tend to be the cheapest, I think. At least for meds. Obviously lots of people order from Cascade. In His Hands, I think, is another reputable place. There's one called Precious Arrows. YourWaterbirth.com also has a significant amount of birth supplies and creates birth kits. And I think Radiant Belly is another one out of Oregon. I don't think it really, I mean, just price shop. I've been pretty fond of the Orion Medical because they manufacture or they sell for all medical specialties, so you tend to get a slightly bigger discount than someone that's just selling midwifery focused. And if you call Orion Medical, they don't have an order website. You have to place orders by fax or calling. If you call them, they'll send you their midwives list, which is just the list of objects that only midwives order. And it also includes meds and antibiotics and things you can't always order because it's including CNMs, but at least it's a lot narrowed down from their giant 45,000 page list or whatever. So yeah, Orion Medical seems to be the cheapest on Pitocin and IV bags and things like that. Okay, let's see. Simply Birth. Yep, that's another one. Great. Okay, well, so does anyone have other questions I'd love to be able to answer for you? It's been fun. This has been a really great time with you all. No, Orion, 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 like the constellation. Yes, Cytotec, Sarah. So answering your question about Cytotec, yes, Cytotec was on my list. That's that bubble packed one. I definitely am a fan of Cytotec. Certainly not for pregnancy or induction, but for postpartum hemorrhage, it is the most effective technique that we have. I think certainly Pitocin is the quicker acting of the two, but Cytotec is the longer acting, and it certainly is quite effective for women, and it requires no refrigeration, and it also is about 12 cents a pill, whereas Pitocin I think is in the 5s now, or $4.50, something like that per vial. So it's a very effective method. There, let's see, we got some questions coming in now. Thanks, Nikki. That's it. Do you carry O2? My O2 goes in the bottom of my hard shell box. Yep. Yep, Cytotec can come from Orion, but you know, Sarah, it's a lot cheaper to get it from your local pharmacy. So if you have prescriptive privileges, go ahead and go to your local pharmacy with your license and ask them to bubble pack it for you. And then you'll get it like I showed you. Oh, thanks, Angela. Good. I'm glad. So as people's questions are just rolling in, I'd like to ask one question of myself, and that would be, would you guys be willing to think of more topics that you'd like me to cover and talk about with you guys, and post the topics here? We already had a request for herbs or homeopathy, and I'd be happy to do that. Let's see. Do you try placenta or cord for hemorrhage? Let's see. I guess I don't understand that question, Amy. Ask it again. Yeah, Amy asked that question again about placenta or cord. I don't understand what you're asking. Yeah, I'll do a homeopathy workshop if you guys want. And I'd also love to do a pharmacology workshop and or other topics. So let me know. Maybe try. Yeah, suturing has to be on site, and I know it's such an important topic. I'm gonna do I'm producing a suturing video right now, of a how-to video. So when I have that out, I'll put that out for you all. But it's not something I could do in this format because it takes so much zooming and editing, and it would be hard to do live. Thanks, Amy. Yeah, definitely come to my suturing workshops. They're so fun. Yeah. Sorry, we had a little connection there. I'd be happy to come to your area to do a workshop if you want to. That would be really fun. Dysfunctional labor techniques, definitely, Bliss. I'd love to add that as a topic we could talk about. Yeah, sure. It's my pleasure. So good to see you all. Oh, I see what you're saying, Amy. Yeah, so we're using a piece of the placenta to treat hemorrhage. You know, I think we've been seeing some great anecdotal evidence that that's working. But as always, we got to go back to that perception and the fact that we are in a litigious state. And so I don't know how you defend that in a court of law if you had access to pharmaceuticals. So if you don't have access to pharmaceuticals, what a great option. And definitely try it. But if you do, you got to use PID or Cytotec first. Okay, let's see. There we go. Hi, Nikki. Disciple, God. Girls, you make me blush. I'm going to be in San Diego December 15th and 16th for you girls down at Najoni. And I don't have a specific skills workshop planned, but if you would like to do a sign-off for well woman's IVs and that sort of thing on Saturday or Thursday afternoon or Saturday morning, I would be more than happy to do that. So go ahead and send me an email on my Najoni email to request those time frames. And especially you graduated students, if you need any more sign-offs, I'd be happy to do that for you this coming Thursday afternoon or Saturday morning. Okay, good deal. Well, I'm going to give about 3 or 4 more minutes for any last questions to come in. So if anyone has anything that they want to share or chat about, let me know. Like I said, this is going to be a monthly workshop for us. It's totally free. Feel free to join anytime. These are going to be watchable later on my Facebook page and on my YouTube channel. And I really am excited to be able to come teach in an area near you. My next workshops are in Arkansas, December 30th and 31st. I'll be in Knoxville, Tennessee, March 25th. 22nd, 23rd, 24th, I think. And then I'll be on Oahu for the 14th and 15th, I believe, of May. So that's going to be really exciting. We have a pretty fun workshop in Oahu with some really affordable prices. So if you want a vacation to Hawaii, let us know. And again, if you'd like to host me in your area, please don't hesitate to contact me. My website is AugustineColebrook.com. It's a work in progress. Don't judge, but it's got some info up there about where I am and what I'm doing. So feel free to contact me through that website as well. Okay, let's see. Sarah's asking, does Cytotec for postpartum affect oxytocin release postpartum like Pitocin does? No, it doesn't. It's a totally different effect. It's a different action. Whereas Pitocin is chemically identical to oxytocin. Cytotec is not at all. Cytotec is works on the smooth muscles of the uterus, just like Pitocin does, but it's not rhythmic. It's more constant. And like I said, it's very effective at cramping the uterus postpartum, and its efficacy can be up to 12 hours. So it's very effective for multips who are concerned about bleeding a lot. Alrighty. Let's see. I think if our questions are winding up, we'll go ahead and say thank you and hugs. Let's see. Yes, thank you, Meryl. Always remove your regulators. Definitely. Always remove your regulators and bleed your valve. That is the easiest way to dislodge that welding so that it can become a missile. And you guys all have heard of that midwife who got in a car wreck and the oxygen tank went like 1.5 feet into the pavement. Luckily it didn't hurt anyone, but it's a really big deal. Okay, great. Thank you. Great to see you all. So great to have all this response. I just love the conversation and getting to talk and share and answer questions. So I'm going to see you in December. We're going to do a mid-December presentation, and let's just go ahead and say homeopathy. That'll be fun. Okay. Have a great day, you all. Thanks again for joining me. I feel really blessed to be in this role and so grateful to get to share midwifery. It's totally my favorite thing. Bye, you guys.